Are you ready to uncover the shocking truth about Medicare that the government doesn't want you to know? Brace yourself, because what I'm about to reveal will change everything you thought you knew about your health care coverage. Picture this. You've worked hard your entire life, paid your taxes, and now you're finally ready to enjoy your golden years. You think you're all set with Medicare, right? Wrong. The ugly reality is that Medicare isn't the safety net you have been led to believe it is. Let's start with the basics. Medicare is supposed to be a comprehensive health insurance program for seniors and certain disabled individuals. But here's the kicker. It's riddled with gaps, limitations, and hidden costs that can leave you financially devastated when you need care the most. First off, let's talk about those premiums. Sure, Part A might be free for most people, but Parts B and D, they'll cost you. And those costs keep rising year after year, eating away at your fixed income. But that's just the tip of the iceberg. Did you know that Medicare doesn't cover long-term care? That's right. If you need extended care in a nursing home or assisted living facility, you're on your own. And let me tell you, those costs can skyrocket faster than you can say retirement savings. But wait, there's more. Dental care? Not covered. Vision care? Nope. Hearing aids? Sorry, you're out of luck. These are all essential services that seniors need, but Medicare leaves you high and dry. And don't even get me started on prescription drug coverage. Sure, Part D exists, but have you seen those deductibles and copays? They can be astronomical, especially for brand-name drugs. Many seniors are forced to choose between their medication and putting food on the table. It's a disgrace. Now, you might be thinking, well, at least I'm covered for major medical expenses. Think again. Medicare has limits on how much it will pay for certain services. And once you hit that cap, you're responsible for the rest. It's like playing healthcare roulette with your life savings on the line. Let's talk about the infamous donut hole in prescription drug coverage. Once you and your plan have spent a certain amount on covered drugs, you enter this coverage gap where you're suddenly responsible for a much larger share of the costs. It's like being punished for needing your medication. And here's a real shocker: Medicare fraud. It's rampant, and it's costing taxpayers billions of dollars every year. Unscrupulous providers bill for services never rendered, overcharge for equipment, or perform unnecessary procedures. And who pays the price? You do, with higher premiums and reduced benefits. But it gets worse. The Medicare Trust Fund is running out of money. Fast, experts predict it could be insolvent in just a few years. What happens then? Benefit cuts? Higher taxes? No one knows for sure, but it's a ticking time bomb that threatens the very foundation of the program. Let's not forget about the bureaucratic nightmare that is Medicare. Trying to navigate the system is like trying to solve a Rubik's Cube blindfolded. The paperwork, the appeals process, the endless phone calls, it's enough to make anyone's head spin. And if you make a mistake, you could end up with denied claims and hefty out-of-pocket expenses. Now, you might be wondering about Medicare Advantage plans. They sound great on paper, right? Lower premiums, extra benefits. But here's the catch. These plans often have narrow networks, meaning your choice of doctors and hospitals is limited. And if you need to see a specialist or get a specific treatment, you might need prior authorization, which can delay your care when you need it most. Speaking of delays, let's talk about wait times. As more baby boomers age into Medicare, the system is becoming increasingly strained. That means longer waits for appointments, procedures, and even emergency care. In some cases, these delays can have serious consequences for your health. And what about preventive care? Sure, Medicare covers some screenings and vaccinations, but there are still gaps. Many seniors find themselves paying out of pocket for important preventive services that could catch health issues early on. It's penny-wise and pound-foolish, potentially leading to more serious and costly health problems down the line. Let's not forget about the geographical disparities in Medicare coverage. Depending on where you live, you might have access to fewer providers, longer wait times, or higher out-of-pocket costs. It's a postcode lottery that determines the quality of your health care in your golden years. Now, I know what you're thinking. But what about Medigap policies? Sure, they can help cover some of the gaps in Medicare coverage, but they come at a price, and that price is often steep, especially for those on fixed incomes. It's like paying for insurance on top of your insurance. Here's another ugly truth. Medicare doesn't cover healthcare costs if you're traveling abroad. Planning that dream vacation you've always wanted? Better factor in the cost of travel insurance, or you could be facing astronomical medical bills if something goes wrong. And let's talk about the complexity of the system. With Parts A, B, C, D, and Medigap plans, it's an alphabet soup of confusion. Many seniors struggle to understand their coverage, leading to unexpected costs and gaps in care. It's a system that seems designed to confuse rather than help. But perhaps the ugliest truth of all is the way Medicare has become a political football. Every election cycle, politicians make promises about protecting or improving Medicare. But the reality is that the program continues to face challenges and cutbacks. It's your health and your future being used as a campaign talking point. So, what can you do about all this? First, educate yourself. Know the ins and outs of your coverage, including what's not covered. Plan ahead for potential healthcare costs in retirement. Consider long-term care insurance while you're still young enough to qualify. And most importantly, make your voice heard. Contact your representatives and demand real reform that protects seniors' health and financial well-being. The ugly truth about Medicare is that it's a system in crisis, failing to provide the comprehensive coverage that seniors need and deserve. It's time to pull back the curtain and face these issues head-on, because your health, your finances, and your future depend on it. Remember, knowledge is power. And now that you know the truth about Medicare, you can take steps to protect yourself and fight for the changes we so desperately need. Don't let the system catch you off guard. Be informed, be prepared, and be vocal. Your golden years and your health are worth fighting for.